health emergency in the Democratic Republic of Congo. The International Federation of the Red Cross and the Red Crescent Societies, IFRC, has launched an urgent appeal for 20 million Swiss francs, and that's roughly 25 million US dollars, to help contain a fresh Ebola outbreak in the Kasai region. Now, this is the first such outbreak there since 2008. And already local health systems are being overwhelmed. Joining us now live from Kinshasa is Ariel Kerstens, who's the head of the country's delegation for the IFRC in the DRC, to tell us a little bit more about the situation, the scale of the response, and the critical gaps that must be filled. A very good morning to you, and thank you so much indeed for joining us.
Thank you very much, Peter, for inviting me this morning to share with you the situation in the province of Kasai in the Democratic Republic of Congo.
Well, let's talk a little bit about the situation there. Where are the outbreaks concentrated, and how many confirmed or probable cases, and sadly even deaths, have been recorded so far?
Well, as you rightly say, the outbreak has been declared by the Minister of Health the 20th of August after a pregnant woman passed away and the two health workers that supported her also passed away. This is the first outbreak in that area since 2008 and is the Zaire strain. The most affected areas so far are Bulape, Mweka, Mushenge, and Kakenge. However, the most impacted one, which is at the epicenter of the outbreak, is Bulape, where the highest number of cases and deaths are there. Our figure, the figure that we manage, is through our network of volunteers that are in the field, is 53 total cases, of which 47 have been confirmed. 10 are probably cases, still, through the process of being confirmed. There are also 33 confirmed death, which brings the fatality rate to 51%, which is a very high fatality rate, which is one of the characteristics of this strain, the Zaire strain. Of course, schools are closed and the economy is constrained, a little bit stalled because of the situation.
How quickly has this outbreak been spreading since detection, and what factors are at play that are maybe complicating efforts to try and contain it, particularly in the remote areas?
Well, 2 weeks ago, when the outbreak started, there were 20 cases. We have 53 cases today. So it is spreading, and it is spreading fast to neighboring this district there in the province of Kasai, but also to other communities. And there is the risk also to, go over the border of the Democratic Republic of Congo to other countries. The situation is complicated because, as you rightly say, there are risk factors in that area, one of which is the very obvious one. It is a remote location with very poor infrastructure. It takes between 3 to 4 days to reach the affected area from the capital, Kinshasa. And that's already, a high constraint when it comes to providing supply, to bring in reinforcing teams, and to do the rotation of the health personnel who is in the front line. There is also a very limited capacity for isolating cases in that area, with only 15 beds available at this stage. And there are, other risks like concurrent epidemic and outbreaks, like, for example, cholera, mpox, and measles. There are also, of course, some other risks related to the actual population and the community living there, like the burial practices are not necessarily safe and dignified, or there is a little bit of community mistrust in the population. There is population displacement because of the conflict in the east of the country, but some also returnees from Angola. And all this increases the vulnerability of the people in the affected area, but also the complexity of the operation to constrain the virus in those areas.
So this funding appeal that you've put out, what do you need the money for urgently? What are your priorities? I guess resourcing the health facilities is one of them.
Indeed. So the money is going to the appeal, the international appeal that we launched for $25 million, as you mentioned rightly. I want to mention also that we have already mobilized over 2.2 million from our immediate response fund to start strengthening the local response of our volunteers in the field. In terms of the need of the gaps, we need to intensify risk communication and community engagement. Most of the prevention work and the constraint and the containing of the virus is about letting people know what the risks are and how they can manage those risks. And for that, the volunteers of the Red Cross are there at the center. They are the neighbors. They are trusted people in the community, and we need to reinforce those actions. And of course, we need to equip those volunteers which are in the front line. That's another of our priorities at this stage, to make sure that they are safe, that they can conduct and they can carry out the activity with the right equipment, and they are protecting themselves and their family when they go back home. We are also strengthening intervention in what we call infection protection and control, which is to make sure that all the facilities that has been where there is the possibility of have been the virus has been there are properly cleaned, are brought back to normal functioning, etc. And also the houses of the people affected or the families who has been in contact with this person. We are also carrying out, and this is maybe one of the main role of the volunteers there, what we call safe and dignified burials, to make sure that the patients that are passing away, the people that are passing away, are receiving a dignified burial according to the practices of the community there, and the family, is receiving also psychosocial support. So those are our priorities, let's say, to mobilize this 20 million or $25 million. Of course, all this is supported by we have already activated our warehouses in Panama and in Dubai, some other warehouses also included here in the Africa continent, like in Cameroon, from where the kits for supporting the local action are coming and the material being distributed.
Right.
Needless to say that this is not an area easy to work. We have already established our base camp there. But there is no power, there is no internet, there is no easy communication around the community. So this emergency appeal that the IFRC has launched to support the activities of the Red Cross Society, the National Red Cross Society, which is working together with the Ministry of Health, is to support all this activity that I have mentioned.
Ariel, we're going to have to leave it there, but thank you very, very much indeed for your time, and most importantly for the work that you and your team are doing out there. And let's hope that this appeal resonates with people and you get the assistance that you need. Thank you so much for your time.
Thank you very much, Peter, for having me this morning. Looking forward to have another chat in the future.
Thank you. That's Ariel Kestens, who's the head of country delegation for the International Federation of Red Cross and Red Crescent Societies in Kinshasa, speaking to us about the Ebola outbreak in the DRC. It's time for your news headlines. Good morning once again to Onel Nsinzi.